morning everyone, I am Dr. Ramandeep Kaur, obstetrician, gynecologist and IVF consultant. Today my topic of discussion is about do's and don'ts in pregnancy. I will deliver very basic information what to do and what not to do in this 9 month of journey. So pregnancy is a beautiful 9 month of journey. Over the period you will have many questions and concerns. And key towards successful pregnancy is you should not hesitate asking us about your concerns and queries. First of all, pregnancy is not a disease and pregnant woman is not a patient. You may living your life as the way you were doing it earlier. As they say, a little goes long a way. So let us look into what makes this journey happy. Pregnancy is of 9 months and we will divide into 3 trimesters. Each trimester is of 3 months. As you can say, the first trimester is the most important. It starts from the first to 12 weeks, 3 months of pregnancy. And what are the role of supplements in first 3 months? Most important is folic acid in first 3 months because it prevents neural tube defects in the baby. I would suggest even who is planning for the pregnancy should start it 3 months prior to the conception. So after 12 weeks is the second trimester start. So what are the other vitamin will add up in the 12 weeks is iron, calcium, vitamin C, vitamin D. That will helpful for the mother and the baby both. Other comes about the diet, what to eat and how much to eat. A healthy mind and the healthy body is good for the pregnant woman and the growing fetus. A woman gain 11 to 16 kg of total body weight throughout the pregnancies. So we need to keep on check how much weight a lady is gaining in the pregnancy. She should not be overweight or obese because it may lead into many other complications. Extra 200 to 300 calorie is required on daily basis for the pregnant woman. Now next I will discuss the 5 important components in the diet the lady is required. The first is carbohydrate. The carbohydrate is all your starch based foods. That includes your chapati, rice, potatoes, pastas and cereals. Second comes fibers, that is lot of fruits and vegetables. Next, a woman should take protein rich diet that is very good for the mother's skin and the brain growth for the growing fetus. The woman should consume the iron-rich food. If you ask about the iron-rich food, for all the non-vegetarian products are the iron-rich. But if the patient is vegetarian, she should consume jaggery, chakkar, gur, pulses in the diet. Some lady don't wanted to have milk. So what are the substitute of milk? You can replace it with the yogurt, curd, lassi and the buttermilk. Next come how much rest is important for the pregnant woman. A healthy body and the healthy mind is important for the pregnant woman. So I would suggest 2 hours sleeps in the afternoon and 8 hours sound sleeps in the night. You do not require more than that and you do not need bed rest in pregnancy. Again, I'm saying pregnancy is not a disease. Next comes about the exercise. It's a good habit. Not only exercise makes you healthy or makes you happy, but it also helps in normal childbirth. Exercises in the form of walking, yogas. Try to avoid overweight exercise as your body allows you. You can do. Now comes the role of vaccines in the pregnancy. Most important vaccination required in the pregnancy is the tetanus. That should be given as early as the 12 weeks or your first antenatal visit, and the second dose is after 1 month of the second dose. That is between 15 to 20 weeks of your pregnancy. Now the second come is Tdap, that is triple vaccine. Tetanus, diphtheria and the pertussis. It's very important. It can be given between 28 to 36 of weeks. It immunizes the newborns in the first 3 months of their life. It prevents from the whooping cough and the diphtheria to the newborn. So it was all about do's. And some even have a queries on the regular basis, the position the woman should lie down. I would suggest at 6 months, till 6 months she can lie down in any position. patient is comfortable or the pregnant woman is comfortable. Because at this time of gestation, the baby is very small, weight does not compresses the major vessels. And after 28 weeks, as the baby start gaining weight or start growing, it may compresses the major vessels of the mother, that may also interfere with the baby blood circulation. So in that case, if the lady lying down on the back or the straight, it will make compress the inferior vena cava. That may also affect the mother in the form of dizziness and discomfort. So I would recommend as the third trimester start or after 28 weeks, the lady should lying down either on the right or the left lateral position. The recommended is the left lateral position for the mother. So next comes about don'ts. Usually pregnancy does not come with too many don'ts, but little extra care doesn't harm. Many pregnant women or their family members, if they're having fever, headache, body ache, some other kind of illness, over the counter they are buying and taking the medication. Stop doing this. Call us, contact us, we will help you out. Because we don't know which medication is manifests a baby's growth and some other problems. Alcohol and smoking should be avoided. Even passive smoking should be avoided. It may interfere with the baby growth and may causes many genetic defects in the baby. So these are the little don'ts that you should be avoided. Even some people usually ask which food to be avoided in the pregnancy. First, my main concern is you to all try to eat home cooked foods. Try to avoid outside foods, or you can say unpasteurized foods, uncooked foods like raw egg, raw milk. The milk should be boiled properly and then consumed it. Avoid fast foods, only home cooked foods. It's not for the pregnant woman, it's for the everyone. You should eat home cooked foods. Next come about the fish. Fish is full of nourishment. It's full of nutrients. So try to avoid sea fish that is high in mercury content. Eat only fresh water fish. All that I would like to say. So I wish you all a very healthy and happy life. Thank you.